Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. So you can also make use of it. My dear friends, today we will discuss 5 important questions. So you can say 5 important MCQs which is related to Kashyapa Samhita. So I have even started a segment of MCQ, so which will going to help so many aspirants of different examinations, entrance examination. Even it is useful for the UG students, it is useful for the PG students, and also for some other interviews and all. So where they usually ask some of the very rare MCQs related to Kashyapa Samhita. So 1 or 2 videos I have already posted in the previous year. So frequently in between we will also post some of the MCQs related to the Kashyapa Samhita in coming classes. So this is today's attempt. So anyway, so we will start with the first question. The question number 1 is, which of the following is mentioned as symptom of infant suffering from jwara according to Kashyapa Samhita? That means according to Kashyapa Samhita, which of the following is mentioned as a symptom of an infant suffering from jwara? Number 1 is, all the body parts of the infants are equally hot, forehead area is cold and extremities are hot, and forehead area is hot and extremities are cold, and chest and abdomen are hot. So now you have to think and answer what is the correct answer among these 4 options. Which of the following is mentioned as symptom of infant suffering from jwara? Now first you have to understand from which chapter as this question. This question is actually from Kashyapa Samhita Vedanadhyaya. In the Vedanadhyaya, Kashyapa mentioned different symptomatology of different conditions or disorders related to the children. One of such condition where he mentioned in Vedanadhyaya is jwara. So when he mentions jwara, so he has mentioned the typical characteristic features of a fever in an infant. Now you have to identify. I have given the first hint. Okay. What he mentioned, whether he mentioned all the body parts of the infants are equally hot? No, he didn't mention that. Whether he mentioned forehead area is cold and extremities are hot? Even the second answer is also wrong. Now look into the last one. Chest and abdomen are hot? No, it is also not mentioned. What actually he mentioned is lalatasya atitaptata and panipadayor shitatvam. Okay, this is the typical nature of an infective fever. Okay, lalatasya abhitaptata panipadasya shitatvam. That means all the body parts are actually hot, but comparatively if you see the middle portion of the body, that is lalata, okay, the midline of the body where the vital organs are there. So lalatasya abhitaptata. So forehead area and other middle areas of the body. So of course in the shloka he only mentioned forehead area, lalatasya abhitaptata. So lalata is very hot, forehead is very hot compared to the peripheral parts of the body, compared to the extremities, panipadasya shitatvam. So compared to the lalata, the panipada area of the baby is comparatively cold. He is not mentioned that it is completely cold. It is not like that. But compared to the lalatasya abhitaptata, the panipada is cold. And this is the typical nature of an infective fever. Sometimes the fever may also increase because of hyperthermia in children. For example, maybe in drug fever, maybe in metabolic disorders, maybe in some environmental hazards, or maybe in heat stroke, etc. So there actually what we find is all the body parts are equally hot. All the body parts are equally hot, and we have to go for cold sponging and fanning, etc. But typically in infective fever we find this particular finding where middle portion of the body is more hot. It may be lalata, it may be the chest, or sometimes it may be back of the examine. It is more hot compared to the extremities of the body. Okay, compared to the extremities of the body. So answer for this question is forehead area is hot and extremities are cold. I hope you understand this question very carefully. So it also includes the clinical aspects. Clinical aspect is in environmental fever or fever other than the infective region, we find hyperthermia where all the body parts are hot. Whereas in case of infective fever, which is actually mentioned by Kashyapa in Vedanadhyaya, we find extremities are comparatively cold when compared to the middle portion of the body like a forehead. So answer for this question is forehead area is hot and extremities are cold. If you want the reference, Jara Vedana Adhyaya Sutrasthana of Kashyapa Samhita, where he says Lalatas Abhitaptata and Panipadasya Shitatva. Now we will go to the second question. The disease of the children in which Jalaukavacharana or leech therapy and as well as Agni Karma are explained. One of the disease of children which is mentioned in Kaumarmritya, where we find Jalaukavacharana as one of the treatment and also Agni Karma as one of the treatment. So options which are given for you is Ulbhaka Roga, Utphullika Roga, Ahiputana Roga and Skandagraha. So hope you are now trying to answer this question. A disease of the children where there is mentioning of Agni Karma and as well as a Jalaukavacharana. And if you say Skandagraha, the last option, in Skandagraha there is no mentioning of Agni Karma and there is also no mentioning of Jalaukavacharana. If you go for Ahiputana, even in Ahiputana, Rasanjana is considered as baseline of treatment, some other Samshodhana therapies are given, and there is no mentioning of Jalaukavacharana. The option is given because one of the disease which is almost similar to Ahiputana is Paschadruja, which is mentioned by Baishaji Ratnavali. In Paschadruja, he says that in Guda area there will be a vrana, and that particular vrana is having the color and shape of the Jalauka. That means the vrana is very reddish, very reddish and inflamed, totally inflamed and reddish, and it is as reddish as the Udara Pradesha of the Jalauka. Jalauka Udaravat Sanniba. Okay, so again, this is just for the confusion, creating confusion, this option is given. It is not even Ahiputana. Talking about Ulbaka, in Ulbaka also there is no mentioning of Agni Karma and as well as Jalaukavacharana. In Ulbaka we find Ajamutra Prayoga, Shanir Ajamutra Prayoga should be done. And then again Sanya Shodhana and some other Shroto Shodhana methods are applied for the Ulbaka. Ulbaka is also called as a Ambupurana, which is occurring immediately after the birth. Maybe a mucoemancipation syndrome like conditions. The only option which is left is Utphullika. Yes, Utphullika is one disease which is mentioned by Yoga Ratnakara, where he says that in case of Utphullika, that is Daksha Kuksha Shishor Bhaveta, Admano Vata Samfulla. Admano Vata Samfulla Daksha Kuksho Shishor Bhaveta. Okay, so Utphullika, Savijnaya, Shwasa Shavatu Shankaraha. So this is the explanation given by Yoga Ratnakara. So in Utphullika Roga, we find Bindu type of Agni Karma and as well as Jalaukavacharana as the line of treatment. So correct answer for this question is Utphullika Roga. Go to the next question, question number 3. Yes. Nagabala Rasayana has been explained as treatment for which of the following as for Kashyapa Samhita? Okay, so according to Kashyapa Samhita, Nagabala Rasayana. First you see the reference, Kashyapa Samhita, Nagabala Rasayana, where it is mentioned. Nagabala Rasayana is mentioned in Chikisasthana, where he is explaining the treatment of one particular disease. That means this is a question from the Chikisasthana of Kashyapa Samhita. Now we shall see which is the correct option. Whether it is mentioned in Pliharoga, whether it is mentioned in Gulmaroga, whether it is mentioned in Pratishaya, or whether it is mentioned in Rajayakshma. The correct option is Nagabala Rasayana is basically mentioned for Pliharoga is the wrong answer. Glulma is also a wrong answer. Pratishaya is also wrong answer, and the right answer is Rajayakshma. Okay, so Nagabala Rasayana is mentioned as one of the best treatment for Rajayakshma in Kashyapa Samhita Chikisasthana. Okay, now beauty of this Nagabala Rasayana is according to Rasayana methods you have to give the Nagabala Rasayana, but we have another important aspect. So just like in Swarna Prashana we will have Shadbhir Maase Shrutadaraha, Swarna Prashana Bhavet. A similar type of explanation is also given in case of Nagabala Rasayana, which is mentioned in case of Rajayakshma, where he says in the Nagabala Rasayana, Shadbhir Maase Shrutadara. Okay, so this is Shadbhir Maase Shrutadara we find in two conditions. One is it is mentioned in Swarna Prashana. Another is Shadbhir Maase Shrutadara is also mentioned in the context of Nagabala Rasayana when he explains Nagabala Rasayana as a treatment for Rajayakshma. So this is another important question. Go to the question number 4, where he says the role of socio-economical status of the family in deciding the prognosis of the disease in a child has been explained in which chapter of Kashyapa Samhita? See, what is the role of socio-economical status? That is the family income, family background, then family socio-economical status. So actually this particular topic has been not dealt by any of the other samhitas. Okay, so when giving the treatment, you should also consider the socio-economical status of the child. Okay, such a type of concept is not, you will not find even in Charaka, Sushruta, Vagbhata, anywhere. But Kashyapa Samhita is one samhita where he mentions that prognosis of the disease is also depends upon the socio-economical status of the parents. Okay, so that is he mentions this particular concept. So this is the question, in which chapter? Whether it is in Snehadhyaya, whether it is in Lehanadhyaya, whether it is in Svedadhyaya, or whether it is in Lashuna Kalpa Adhyaya. It is Lashuna Kalpa Adhyaya. Now this is the question, you have to say in which chapter this concept is appearing in Kashyapa Samhita. Now he says that he again divides the patient as Daridra, Madhyama and Uttama. Okay, and then again he says that the disease in a rich person, okay, a asadhya disease in a rich person may be also become sadhya, and a sadhya roga in a poor person may also become asadhya. Okay, these are the explanations given for the socio-economic status, where he says that a disease which is asadhya may also turn as sadhya in a rich patient, and vice versa, because the prognosis of the disease depends upon the three important things. One is dana, ahara and dakshina, like that. Ahara, dakshina and dana. That means if you are able to afford something much more, then even the disease which is asadhya can be also treated. So like this explanation is given in Kashyapa Samhita. The question is in which chapter it is present. Is it present in Lashuna Kalpa Adhyaya? No. Is it present in Snehadhyaya? No. Is it present in Lehanadhyaya? No. We can't find such references. It is found in Swedha Adhyaya of Kashyapa Samhita Sutrastha. This is question number 4. Then we'll go for the last question for today's class. That is question number 5. As for Kashyapa, the proper age for tooth eruption in a healthy infant is? Is it 5 months onwards, 6 months onwards, 7 months onwards, 8 months onwards? So we have got different, even Vagbhata also explains a beautiful explanation about the dentition. Okay, where he says that in which month actually the tooth is inseminated during the pregnancy. After birth, in the similar same number of months, the teeth will go into erupt, and in the same number of years, the teeth will go into fall. Primary teeth will go into fall. Such a beautiful explanation is given by Vagbhata also. But here the question is, according to Kashyapa, the proper age of tooth eruption in a healthy infant is? Is it 5 months onwards, 6 months onwards, 7 months onwards, 8 months onwards? Now Kashyapa explains the symptoms of teeth which appears in the 5th month. Okay, like Samruta, Vivruta, like that. Okay, 6 months onwards, if the teeth appears, what is the properties of the teeth? That is also mentioned. 7 months also mentioned, 8th month is also mentioned. But the question is, which is the best age, proper age for the tooth eruption according to Kashyapa? The correct answer is 8th month onwards. Ashtamo mase parato va pravartate. Sa dirghayusha. If the tooth eruption starts after the 8th month onwards, then it is considered as Sreshta according to Kashyapa, because tooth will be well manifested, well formed, and the density will be more, and it is properly mineralized. That was the idea. Therefore, he says that if the tooth eruption starts before 8th month, then it may not be so strong. But if it starts after 8th month onwards, then it is considered as Sreshta, and also Dirghayusha, long lasting. Of course, he is talking about the primary teeth, so it cannot be long lasting, but still he says that it's well mineralized. Okay, so these are the 5 important questions for today. Thank you very much. I hope you will get benefited. Don't forget to subscribe to my channel, and also please give your valuable comments. Thank you very much.